Well, welcome everybody. Welcome to the 2023 Virtual Compassionate Action Healthcare Conference Member Day. I'm Julie Collier, Senior Director of Programs at the Schwartz Center. Thank you for joining us for this panel discussion, Approaches to Stress First Aid Implementation. The beauty and the challenge of stress first aid is that the model is incredibly flexible. It can be adapted in many ways to suit an organization's needs, which is really wonderful. But this flexibility can also be challenging. It's not a plug and play program. There's no single template for implementation. So the challenge then is how to design an implementation approach or strategy that will work for your particular organization. So we've assembled a fantastic panel today with stress first aid leaders from 3 organizations, and they will each share with us their approach to implementation. So let me introduce our panelists. We have Joey Burke, nurse ethicist from the University of Kentucky Healthcare, University of Kentucky. Don Damiano, Director of Employee Wellness at Hebrew Senior Life. Christy DeVries, the UMatter Program Manager at Nationwide Children's Hospital. And Reverend Christine Ross, Pediatric Staff Chaplain at UK Healthcare. And Sarah Sjostrom, Associate Chief Nursing Officer and VP of Ancillary Services at Hebrew Senior Life. So please join me in welcoming our panelists, and we will hand it off to our friends from the University of Kentucky.
Hi, good afternoon. I will work on sharing my screen. There we go. Is it working?
Yes.
Okay, well, I'm going to let Joey start off our discussion.
Christine, do you want to give any introductions of you? First.
I have been at UK for about 13-14 years and trained here before that. So this is my home. I was a chaplain for the entire hospital for the first 6 years. And then the last 7 years, I have been the pediatric chaplain. My calling into chaplaincy was caring for the caregiver. So I've always been very interested in finding programs and ways of supporting our staff. And so that was one of the things that hooked me with stress first aid.
I'm Joey Burke. I work alongside Christine Ross. I was a bedside nurse for 20 years, and along the way was part of the first team from UK to launch Schwartz rounds. And so the career path for me has threads from the Schwartz Center for Compassionate Care that took me from the nurse champion for Schwartz rounds into the role as nurse ethicist. So after being at the bedside for many years, it was time to make a career change, as many of you may appreciate. And the 2 things that I really was passionate about was being on the ethics committee and working with Schwartz rounds. And so we then created the position as a nurse ethicist, not realizing that COVID was going to be on the calendar. And so my start date was a day that we really had a change in healthcare at the University of Kentucky. We closed to the clinics. We sent people home. And so my first day as nurse ethicist was trying to figure out, well, what does a nurse ethicist do during a pandemic? And what we found out quickly was that my role had everything to do with moral distress. And so partnered with chaplains to do quite a bit of rounding. We literally were going to people in the halls. Are you okay? Do you have what you need? Do you have toilet paper? Or those very basic needs. And so moral distress became something that we were acutely aware of. So when the stress first aid information started rolling out, it fit particularly with what we were dealing with. So we come to you today from the University of Kentucky campus. Many of you may be more familiar with our athletics department than the UK Healthcare. But just to give you an idea of size and scope, we are 3 hospitals, essentially. On one campus, we have active Schwartz rounds committees at 3 different sites. And so we've had a long relationship with the Schwartz Center for Compassionate Care. So as we looked at the needs of our staff, the opportunity to reach almost 12,000 employees, and try to provide a new approach to addressing some of the issues that they were dealing with. So I will pass the microphone to Christine, who's going to start our deep dive into our journey.
Well, our journey started in 2020, as Joey mentioned. We were introduced to Schwartz rounds through the webinars from the Schwartz Center, introduced to Stress First Aid, the webinars. Of course, in the midst of COVID, we weren't able to do very much with it at that point. We got permission in December of 2020 to move forward, and we were part of the cohort, Stress First Aid cohort of spring of 21. Just as we were finishing that, we had our epic rollout for the new medical record system, and then COVID started going up. So we did not start the program at that point. We remembered in our training that when you're in the orange and the red, you're not going to take on new information. And we were very concerned about making sure we had a good start, a solid start, because this program was important to all of us on the team. So we started the first pilot in the summer of 22. And then in fall of 22, we started targeted groups. We also developed a partnership with our UK wellness and HR program. And since then, we have been continuing to do targeted cohorts. Our goal is changing of culture. So we started with the middle management people. We went for just kind of first line unit managers and rolling out to several of them to begin with. And then some different ancillary staff that went with that. And then after that, we went back up to the C-suite. That was more to get them involved. And then we're coming back down. One of our first groups as well was ambulatory department. And so all of their managers in the ambulatory clinics were participated in this training. So as we go forward, and as we've been doing these groups, there have been a lot of interest in what we're doing. We have some badge buddies that we'll show you a quick version at the end, and people will stop you and ask about the badge buddy. So in that process, we had people from the College of Nursing say, "What is that? I want one of those." And so some of them came and took and went through the training. And then I think a couple of them even went through the train the trainer. And then we also had some interest from School of Medicine and from the broader campus, UK campus, their student success and different student wellness programs. So we now have a group of people from HR that have been trained as train the trainers, and they are doing a pilot rollout for the campus management, the university side. So that's kind of where we are and where we are or have been. We do the training in small groups. We keep it 12 or less because because the discussion is so important. We have found that we don't want to have direct reports either direction in the groups because it makes it easier to have the discussions. And we have wonderful, wonderful discussions about the stress that people are dealing with. And then it creates a very interactive way of working and helps people to really integrate what they're doing. Let me go on and let Joey share a little bit more about some of our challenges, and then we'll get back to some of the other stuff.
So as you can imagine, pulling together a stress first aid program requires time, and we all have other full-time jobs that also consume our time. But we recognize that not only are we busy, but the people that we are trying to train potentially on stress first aid, also they are busy. And so although this fits really naturally into my role as nurse ethicist, Christine's role as chaplain, there are time constraints. And so while we wish we could offer classes all day, every day, there are time constraints that are real. Also, we recognize that the people that we are most interested in attracting are busy people. Nurses in particular are frequently operating in situations where they are short-staffed. And so pulling people away can be very difficult. So we have been very conscious, aware of our time. We limit our group time for training usually to about an hour and a half. The first hour is pretty didactic. And then the last 30 minutes really is sort of putting it into practice. And so that time frame seems to be about, through trial and error, that hour and a half seems to be kind of a sweet spot. So we recognize we are busy, our folks are busy, but it is something that we continue to get positive feedback. And so constantly, the long game is in sight, that we recognize that this is valuable and it is worth our time. So what we also recognize as a barrier is that we have quite a bit of staff turnover. And so even if we have gone into a unit, have done some training, 6 months later, they have had a turnover in staff. And so we're having to go back. That's a blessing and a curse because we now have new audience members. But we recognize that not only is there staff turnover within our staff, but also management, leadership, executive leadership. And so that retraining is not just the nuts and bolts of this is stress first aid, but having to often address awareness, that we feel like everybody should know that we exist, and then we realize absolutely that's not true. We are constantly getting the word out, explaining who we are, what we do, how it works, and so we see that as an opportunity. So as we are working towards those long-term goals of actually changing the culture, it really does begin with a grassroots effort, and by that I think what I recognize is we are creating your circle of support, and in that circle of support, you are both the recipient of your circle and also providing that support to other people. So we really recognize that the C's of stress first aid and the building community and those elements are critically important. And so this is not something that is a one-shot, one deal. Leadership says this is what we're doing, but this is actively the people who you engage with, interact with every day. It is your circle, and you are both the recipient of the support and the provider of the support. So as we have rolled out stress first aid, we truly have experienced growth spurts. We know that as we have reached out to folks, it has opened up channels that we didn't realize, or we didn't have a path until, for example, we got HR involved. Then that was a big growth day, because it opened up so many more resources than we thought possible. When we made the connection with DEI, diversity, equity, and inclusion, that opened up groups, identity groups, that we could then target in ways that we had not imagined before. So as we made big growth jumps with including other colleges, other groups across campus, and so this is something that is a continual growth, but recognize that you will have some slowdown and speeding up at various points. I think as we have rolled this out, what we have been most impressed with is the flexibility and adaptability and creativity that we have seen as this is being rolled out. So we've had teams who have said, hey, we want this on a wall. We want to put it on the refrigerator. We want a big poster of this, not just a badge buddy. We've had teams say, we are using this for our performance evaluations, and it's a way to start the conversation with our employees. We've had folks say, we used the color coding in a Zoom meeting, and we asked people, tell us what your color is and tell us what's the color of your team. And it just allowed us to have a rich conversation about how's our team holding up. And so we are constantly impressed by the ways that the information comes back to us on how different teams are using the strategies and what it looks like in individual units. We know that what is stressful for the emergency room is not what is stressful for the C-suite, and yet stress is stress. And so being able to adapt things to very real scenarios, real people situations has been incredibly important. The diversity of the folks that we reach out to really speaks to the flexibility of the program. So the things that we have put together really are mindful of the fact that we hope to create a culture where addressing stress and addressing the needs of our staff really is the cultural shift that we are trying to make space for.
And we asked about metrics, and that's a question we get a lot about metrics. And with a lot of these programs that are about people and about our feelings, and our numbers just don't quite adequately capture it. So what we have been looking at is the stories that we hear, and that's our measure. So when someone says, this helped me be more aware of myself and figure out where I am and what I need to do, one of the nurses said she looks at her badge buddy with the 7 C's and circles around it and tries to figure out where she is and what's going on. Just in that badge buddy part, when one of the nurses who had been here for 20 years said, this is the first badge buddy I wanted to wear, like that's a measure of success. The people who have used it with some of their students, the student reported like looking at the stress continuum and being able to just share a color. I don't have to be labeled. And then the awareness that this color isn't permanent when you pick it. Once you pick red, you're not always red. You can move. And so that's been liberating for people. They've also talked about just the idea of they like it being a continuum, so nothing's set in stone. And it makes it feel safe and okay. Another long-term employee had talked about it was the best class, the most beneficial class she's ever had as a leader. So those are good things. One of our colleagues is a pediatric anesthesiologist, and she said people just notice, like when she's working with the kids, the kids will notice it and ask her about the pictures on the badge, and then she's able to talk to them a little bit about their stress before they're going into surgery by using that. And then, of course, her surgeon colleagues, she can use it with them a little bit, like, let's think about where we are and what we need to do. And then, just that nice thing about when someone says, where can I get one of those? And we say, you go through the class and then you come back for the follow-up, and then we'll give you a badge buddy. So that's kind of our lure. This is just a blown up copy of what the badge buddy looks like. We want it to be a little bit fun and easy to read and be sensitive to people with vision issues and color blindness. So that's that quick. And then we wanted to show that this is it's not just me and Joey. We say we're just a couple people, but there's a whole bunch of us.
Yes, Christine and I may be the people on the screen at the moment, but really much like running the movie credits at the end, you realize that there are a lot of people, a lot of hands have touched the movie, but we really do rely on a great number of people to keep things rolling, reach out to new folks, and it takes a village indeed.
Great, thank you both. I love that this is the first badge buddy I really wanted to wear, coming from an organization that also liked badge buddies, and that's high praise. Okay, so next we have our team from Hebrew Senior Life. Thank you, Joey and Christine.
Hey everyone, I'm so excited to be here. Let me share my screen. Right, can everyone see my screen? Awesome.
Yes.
So I am Dawn Damiano, and I am the Director of Employee Wellness for Hebrew Senior Life in Boston. And I have been with HSL for quite some time, about 30 years. And over the course of that 30 years have been involved in different aspects of employee wellness. They started in the 90s as a volunteer sort of committee, and it slowly turned into actual programming with value and value on investment and return on investment and programming all around, support from senior staff and programming around every aspect of people's well-being. I'm happy to have teamed up with Sarah Sostrom on this project and this program, which has morphed into a major part of our employee wellness program. And Sarah, if you'd like to introduce yourself.
Sure. I'm Sarah Sjostrom. I'm our, as you saw on the slide in the beginning, the Associate Chief Nursing Officer and Vice President of Ancillary Services. I work in our Dedham location, but cover a lot of our inpatient units and our healthcare center sites. And I have worked for HSL for just over 13 years. And I've had the pleasure of working in a number of different units across our healthcare center, from acute care units to short-term rehab to our long-term chronic hospital floors, and have had the pleasure of partnering with people across the continuum of services that we provide. So it's allowed me a great opportunity to work with a number of different people who have to function in a lot of different capacities in their day-to-day as they provide care services. Which I guess segues in great into this slide right here, which is a little bit about who we are as an organization. We are New England's largest nonprofit provider of senior care services. As Dawn mentioned, we're in the Boston area, and we have 6 sites across the greater Boston area. As you can see in this little map here, we cover a pretty broad range north to south in the greater Boston and metro area. We are one of the 40 largest employers in the Boston area as well. We've got about 2,400 employees across those sites. And we've really have the privilege of having been recognized as a Boston Globe Top Place to Work 5 times now, including this past year. As we mentioned, we have a large continuum of care services that range from independent and assisted living in our CCRC communities to inpatient, short-term rehab and longer-term care, as well as home care, hospice care, ambulatory services, and we are home to the Marcus Institute for Aging Research and the growing ambulatory memory care center. So we are also an academic affiliate and the only senior care organization that happens to be affiliated with our Harvard Med School.
Yeah, and Sarah and I sort of come a little bit from 2 separate worlds, where I am HR and Sarah is nursing. And the combination, though, has just been the perfect partnership. Our 2 sides have been able to really spread this program across our organization like wildfire. It's been great and it's been fun, and we're looking forward to sharing it with you. I can get to the next one. All right, so our stress first aid program, where did it begin? Like, just like everyone else, you know, COVID hit, and we thought, oh my gosh, what can we possibly do for our staff that is having a terribly difficult time, just like everyone at today's session. We had, years prior to COVID, really turned a focus onto our employees' mental well-being and implemented programming around that. We had our CEO on board from the get-go. He signed on with NAMI, CEOs Against Stigma. We implemented a program called Marvin that gave our employees three free sessions with a therapist. We then implemented Ginger, and really Ginger is a mental health platform where folks can receive mental health coaching and also work with therapists. And then in the midst of the highest part of COVID in November of 2020, we were lucky enough to be part of the first cohort of stress first aid training. And we did have a group of stress first aid responders that went through it with us. And, you know, after we went through the training, we were together thinking, how are we ever going to roll out this peer-to-peer support program? Like, how can we roll something out where and ask people to support one another without even really knowing how to support themselves first? So we decided to leverage the existing wellness program called Live Well and create a program that could fall under the Live Well umbrella, and one that would grow and exist and continue on for many years to come. And that is leading us into the next slide that Sarah will take over, and really, how do we do it and where did we go?
Yeah, so we were trying to, as Dawn mentioned, really boil this down into a way that felt accessible to both our frontline teams and their leaders so that we could support each other. And really from the get-go, in order to have to make sure this aligned well with our organization and to continue to have the full support of our administration, we really wanted to make sure that whatever we developed was really aligned with our cultural beliefs as an organization, just to make sure that we could put this into a framework that everyone could connect to and everyone could relate back to. And so we knew kind of where we were going. So in order to do that, we adapted some of the language as we went along, and we made sure to think about this from an administrative perspective in terms of how we build this into the goals of our organization and our key drivers. And really, as we were kind of thinking about that, what came to life was creating a stress first aid toolkit that not only sort of meets those goals, but then really for the people on the receiving end, all of our employees, it is able to kind of step by step walk them through how to make stress first aid and a part of the daily life within our four walls, and hopefully things they would carry with them into their personal life as well. And so that goes from just the initial teaching of what is stress first aid to begin with, all the way through to, once you've kind of become familiar with some of the concepts, what can you do to keep this stress first aid a part of the living, breathing daily work you do, in terms of not only a proactive approach to stress, but when there is proactive, I'd say, to preventing stress, but then when there are these flares of acute stress, how do we respond accordingly?
Yeah. And we just wanted to share with you really how we aligned stress first aid with our cultural beliefs and sort of had it become part of the culture of care that we've created. And we use this at orientation. We introduce everyone to stress first aid at new hire orientation. And this is one of the first slides we share. And really, first they learn our cultural beliefs, and then they learn really, okay, how does stress first aid align with it? And, as you can see, we've matched them perfectly. Stress first aid helps us to lead the way by creating an environment where it's okay to not be okay. From everyone across the organization, from leadership to frontline workers, we are providing access to everyone and really leading the way in that. And it also helps us to succeed together and team up by learning and using an organizational common language around stress. And like Sarah said, this is one of the very first things we did is to think about, okay, how can we introduce this common language, and why is this the important first step? And we'll share that in a minute. Stress first aid, our program also helps us to speak up by asking for help when you need it. Once you learn the common language, and once everyone is using it, you can use it to ask for help, or you can use it to offer help. Stress First Aid also helps us to ask what matters and to show respect, to each other by learning that we move through that stress continuum throughout the day. And you can learn to recognize if a colleague has been bumped out of their green zone or if you've been bumped out, and to show compassion and respect and respond appropriately instead of taking things personally and maybe reacting. And finally, Stress First Aid has, helps us to go beyond by regularly checking in with someone, checking in with yourself, and notice if someone needs help, and and then learn the steps to refer the person to a trusted individual or a service they might find useful. So tying all of this together was a wonderful way to roll it out, and really a way that people could understand and see, okay, this fits in that culture we have created. So how does the program work? It really took us probably about 6 months of brainstorming and blood, sweat, and tears to figure out, how are we going to roll this out? How are we going to make this last? How are we going to make an impact? And how are we going to teach people how to use it? So we came up with the Stress First Aid toolkit, like Sarah said, and it's probably about a 20 long page toolkit that walks you through each step. And what we decided to do was mix sessions of instructional workshops with self-care experiential workshops. And the very first workshop that you'll learn is the common language. So introduction of the common language. And we adapted the Schwartz Center's the stress continuum model a little, and we put a little something for everyone, whether they're going to recognize through colors or the gas tank and the battery. We just know that people learn differently. This is the very first thing that people learn as new hires. We have one of the measurements that we did was, like Sarah mentioned, in our goals and key drivers, a goal was to implement one of our workshops at each of our locations. And this workshop was introduced at each location and within almost all of the departments. And so everyone is using this. So if someone says, hey, I'm in the green today, you seem like maybe you're not okay, how can I help you? And they can go to their managers and say, I'm in the orange, how can, is there something you can do to help me? It's the perfect start off. And the workshop has a little bit more than just introducing this language, but that's the number one goal. And then we go and alternate from this instructional didactic to self-care and experiential. And the next one is really learning how to take a pause and respond rather than react. Our CEO, when we brought this to him, he said one of the things that people have been saying to me is that there is a sort of lack of civility among staff. People are snapping at each other. So we thought this would be a really important thing to teach people the importance of a pause, how to stop, how to proceed, and different ways of pausing and regaining yourself back to green. So you learn that, and then you're able to provide that to someone if you notice they're bumped out of their green zone. Then we go back to, I keep going the wrong way. We go back to another instructional, and we introduce the 7 C's. Only again, we adapted the Stress First Aid sandwich from the original 7C model. We really wanted everyone to be able to connect and understand. And so we wanted to make it as easy as possible. And Sarah, if you want to describe the Stress First Aid sandwich, that would be great.
Sure. We, of course, like the 7 C's and thought it served as the perfect foundation, but we also recognized that we have a lot of different people with a lot of different learning needs and wanted to break it down as much as we could into a way that felt accessible. And so we were just sitting around one day talking about, like, how do we teach the 7 C's? Like, how is this going to make sense to people? How do we see this? And the idea of the Stress First Aid sandwich was born. And I forget entirely how that came to be. But we were talking about the things we always want to do and what we may need to do. And we thought, you're always sort of checking, you're always kind of teaching people to be in touch with how they're feeling or to be observing how their team members and others are feeling. So, like, you're always going to be checking. That's always a part of the sandwich. And you're always going to want to be thoughtful about the coordinating in terms of what are your resources? Do I need help? So those are two concepts we wanted to make sure were foundational. And just like a sandwich, you can't have the sandwich without the bread, I guess, right? So those served as our anchoring pieces. And then every situation is different. And we wanted people to feel like it wasn't, that they didn't necessarily have to do everything every time for it to be a successful interaction. And so we wanted to let people know, like, you check, you coordinate, but then you also think about what's in the circumstances. What do I need, or what does the person that I'm talking to need? Do they need to feel more connected to someone? And is it okay if I just check in and then provide them some connection, and then maybe think about if they need something else beyond that interaction? Or maybe we have one of our educators who recognize that someone's very stressed because they're feeling like they don't understand a process and it's causing them a lot of anxiety. And just building up their competency and really doing some teaching with them will help put them at ease. That, you don't necessarily have to do every single one of the C's or every single one of these things to have it be successful, a successful outcome. So we thought a sandwich was great because you could kind of do the check, do the coordinate, but think about maybe some combination of those factors in the middle. And we didn't use all C's because we thought just for our population of staff who may speak English as a second language, that using some other words like safety and hope may connect a little bit better for people.
Yeah. So in the toolkit that our team leaders can use, our employees can use, these are the first 3 workshops. And then from there, they can sort of choose what their team might need. So just to give you a few examples of what else is in the toolkit, we usually recommend that the next workshop is art therapy. And this has been an amazing success across the organization. People are, of course, a little nervous at first, like, I can't draw, this is going to be terrible. And then they get into it and you just see people in a trance of taking part in this art therapy. And we have done sessions across all of our sites in multiple departments, and they love it. And this one's continuing. The art therapists have come back to locations and departments multiple times. And then from there, they could choose a healthy thinking workshop, another instructional one, guided relaxation. And we chose in the toolkit to go with guided relaxation rather than guided meditation, because people, again, get a little afraid of meditation and shut down. And I don't want to meditate. I'm not going to do it. And if we thought, oh, let's call it guided relaxation, they're going to want to do it. Who doesn't want to relax, right? Forming healthy habits is another instructional workshop. Chair massage for teams, building resilience, dealing with burnout. Reiki has been a great one, and journaling. So we have even done one-day workshops where we introduce a lot of these. So we start with that common language. We teach people about the pause, teach people about the stress first aid sandwich. And then we've had stress first aid stations where they spend about 10 minutes at any number of these on the bottom. And leadership has loved those. They then take pieces of that to their teams. And, one team everyone has gotten the introduction to the language, everyone's using it, but one team might have an acute stress situation going on and want, okay, we need a guided relaxation or a chair massage. And they might not necessarily go in order. They're going to do what they need, but they have this toolkit laid out in front of them to choose from and to help their teams. All right. So what's next for the program? Where are we going with this?
So I think first and foremost, we of course want to make sure that this becomes an integral part of everything that we do. And we continue to seek ways that we can embed this as much as possible in our day-to-day culture. So some of the things we've done in order to accomplish this is try to transfer the work from those first aid responders that really have sort of like taken up the helm of being the, people doing the initial teaching, down to all of the team leaders, department heads. And we've really seen some great success with this in terms of huddles that are going on the floors and teaching just some really basic things and seeing those come to life, like just starting off a huddle at change of shift on a nursing floor with, hey, how's everyone doing today? And getting people comfortable with saying, I'm in the red, I'm in the yellow. And we've had some team leaders say, you know, I've started going to the floors and now my whole team is responding as a team. Like our team's in the yellow, our team's in the green. And that's helped to fortify some of the teamwork as well. And also streamline for the managers, like, hey, now I know where I need to give a little support. If the entire team is saying they're having a rough day, we can head over there. It's also been something that we've incorporated into some of our leadership team meetings through making the leaders practice what they preach a little bit in terms of we're going to have you using these stress first aid tools in our leadership strategic meetings, and then each time trying something different that they can then, as Dawn noted, bring back to their teams. And one of the other things that we've tried to do is continue to infuse new things and new aspects to the program. One of which is Code Lavender, which is really recognizing how we can even more acutely address an instance of stress. For example, when we have a patient pass, or we had an incident most recently where we actually had the team notified that one of their fellow employees had passed away unexpectedly. And the Code Lavender is sort of that emergency or rapid response component of stress first aid, where it calls upon sort of a team of folks from professional development or spiritual care to be able to respond with sort of a go cart or like the emergency code cart full of items that might be helpful for dealing with some times of stress. And that's been very new to the mix, but already pretty vital to the floors.
Yeah, and a lot of those items that were at the bottom of the program listings have been what people have been using for the Code Lavender. So there's even a pet therapy section where we could bring dogs in and, you know, just let them hug it out with the dogs, or providing the chair massage where people could just relax and quickly feel a little bit of relief and a little bit of relaxation. The other thing we want to do, you know, when we went through that first cohort in November of 2020, we had a team of stress first aid responders that were helping us roll this out across the organization. But with anything, I mean, they had a lot going on with their own jobs and were busy. And a lot of this fell on Sarah and I to roll out and to present and to teach. And since then, many of our stress first aid responders have moved on to other organizations, other jobs. Some have just said, I've got too much going on. We really need to start recruiting a new class of stress first aid responders if we want this to successfully keep going, because Sarah and I can only carry it so much. And then along with that, we really want to create and start training some of our team members to lead peer-to-peer support groups. So we want to create those groups at each of our sites and train the trainer, sort of like Joey and Christine have done. That'll be a big one, because again, we can only do so much before we burn out ourselves. And then we want to make sure that we're staying relevant with our programming to help the stressors. You know, it's been one thing after another in this world, and we are addressing things as we go along, and we just want to make sure that we stay as relevant as possible. And, you know, just going back a little bit to what Sarah was talking about is in terms of remaining an integral part of our culture, just like Joey and Christine said, we are using this in our Zoom meetings, in our meetings where we get together. I've noticed everyone will start off with, how is everyone feeling today? Where are you on the stress continuum? And people are happy to talk about it, to say what color they are without hesitation. You know, it's safe. They know it's okay to not be okay. And they know it's okay to ask for a mental health day. And everyone is going through this training. So there should really be no fear, and there really isn't any fear in expressing how you feel anymore, which is great, because when we started out first working with our mental health well-being aspect of our wellness program, there was a big stigma with it, and it was scary to say you weren't okay. And now, with the help of Stress First Aid and what we've done, it's okay to not be okay, and it's safe. So.
Thank you both, Dawn and Sarah. That is really wonderful. A lot of really great work there. Last but not least is Christy from Nationwide, who's got a bit of a different angle on implementing stress first aid to share with us. Oh, you're on mute still.
That's good, because I had a cough right as it's time for me. So I'm really happy to be here, and thank you for the opportunity to share. I did hide some of my slides just to, really use the time mindfully. So this slide deck in its entirety will be available to you, which will have some more information about children's and things that happen before stress first aid.
And Christy, can you put it in presenter mode?
Oh, yes, thank you. Do I need to flip it?
Yes.
Okay.
There you go.
I'm still in the green, so we're good. So I'm going to go ahead and tell you just a little bit about Nationwide Children's You Matter program, which will lead into specifically information about stress first aid. So as you can see, our staff support program started in 2013, and we have celebrated 10 years this year. And so what I am sharing, if you're new to stress first aid, I just want you to be mindful that our program was pretty mature when we learned about it, so that you don't get discouraged. And like the others who have shared already, in the midst of learning the pandemic was a real thing, we also heard about stress first aid from Schwartz. I had told all of my staff, because we were sent home. I have 5 full-time staff and 2 contingent evening weekend staff. And we were told to go home. We were not essential. So we were working on CEUs, and Schwartz is a wonderful provider. So we learned about stress first aid. And another side point is I just started being the manager in January of 2020. So I had a good idea of what the different workers were doing. There were some universal interventions being provided, but there was a lot of clinicians, mental health, where social workers and counselors kind of doing the thing that interested them the most. And stress first aid helped pull us together in an idea of flexible uniformity. So when people want to know what do the stress or the You Matter clinicians do, we provide stress first aid to the employees of Nationwide Children's, and we teach other people to provide stress first aid to each other. There are 16,000 people here. And so although a team of 5 sounds large, it really is not enough to be able to support everyone. These are the foundation programs that we had. The Second Victim program, which is the Sue Scott model, many of you may be familiar with. And our peer supporters in the Second Victim program, we are teaching them wholeheartedly to use stress first aid interventions as the how of peer support. We have a critical response team. We have the Schwartz rounds. We have our EAP program. And then my team provides an awful lot of education around subjects of well-being, resilience, and stress management, and stress first aid. So what I realized after hearing from people when we had trained, so I'm kind of going past when we started training and then I'll go back again. We kept hearing that there was an awful lot to the model and it was really hard to remember. And that was specifically people who didn't have behavioral health education, because the folks in behavioral health got it right away. So we decided that the best way to ensure we were impacting people as best we could was to come up with an elevator speech. This is a little bit longer than an elevator speech, but it is the thing that we repeat over and over and over that our interventions reflect and that we teach other people to do. So the first one is stress first aid. And we have decided the continuum, check, and coordinate are the most important elements for our organization, and I'll come back to that. We also are focusing on self-compassion because I'm new to healthcare. I've been here 4 years. I worked in child welfare for 30. What I noticed in healthcare is a desire for stoicism and resilience, which basically means don't have emotional side effects from the job, like just keep marching. So we wanted self-compassion to be reflected in the way that we provide stress first aid. We spend a lot of time speaking to people, modeling and intervening on self-regulation. So in the moment when the critical incident or the high level of stress impacts you, or maybe, you know, a patient, an adverse patient event or violence, how do you compose yourself? What do you do? And as you notice, the compassion and the self-regulation really kind of goes with the cover and calm. The next one is reframing. How do we assist one another and recognizing that we may need to check in on our perception or our mindset? And that's a tricky, we don't want to invalidate people, but we also have to remind people that we can't control everything. We need to look at controlling the controllables. And then the final one is replenishing while you're working and after work. We initially were focusing on how do you leave work at work, but we realized that that's not enough time. We have to teach people how to replenish during the workday, or they're not going to be able to leave work at work because their nervous system is going to be so fired up. That's a tricky one. How do you take a break? So I know this will be familiar to you, but if you look closely, you'll notice that some of the wording is different. We also got feedback that the stress injury and the stress illness, people just weren't getting it. And one day as I was scrolling through Instagram, this popped up. I do not know who the original author was. I have searched and searched, but it uses language that is more palatable to our teams. So I'm thriving, I'm surviving, I'm struggling, I'm in crisis. We don't tend to use those words though. What we tend to do, you know, like previous speakers, is we talk about the color. I'm feeling green today. Most of us at NCH, and there will be some who argue, are yellow. Like we live in the yellow, we're always stressed. It's always high levels of stress, but we are managing. And then we're most concerned about people who are in the orange and the red. But of course, we spend an incredible amount of time normalizing that. If you're on the way to work and your child, you know, falls down and gets all muddy and you have a presentation at 9 and the traffic is bad, you're going to go into the orange for a little while. And so, yes, orange could be a situation where we're very concerned for you, but there's also times when it just pops up. It just is the way that it is. Now, this slide is a slide that everyone, fingers crossed, at NCH would recognize. The continuum, and this is our check you, check to, and coordinate slide. Now, the language check you, check to was actually started by Rutgers University back in, I think, 2020 or super early in 21. We had Schwartz stress first aid community meetings, and we got permission to use that, and it really has taken off. So we are using this in collaboration with the stress first aid continuum for people to check on how they themselves are doing. Start with you. And then while you're thinking about how you're doing and you adjust your expectations for yourself accordingly, then you also think of a couple colleagues that you're going to check in on as well. And we always remind people that we're not saying walk up to Julie and say, how's your mental health today? What we're really saying is, Julie, you seem a little more quiet than usual today. How are you doing? So we're human, we have relationships, we know who our colleagues are and what their baseline is like. And so when we see somebody is not themselves, we're really trying to create that that community of compassion. I heard you say earlier, community of caring, so that we do ask. And if someone doesn't want to say, we'll respect that, but let's not check in. And I want you to know that the continuum and the check, oh, I didn't finish about the rest of it. And when you're checking in with your colleague, if they share with you something that is bigger than you know how to manage, then coordinate with the You Matter clinicians. So there are going to be times that our colleagues are experiencing distressing events that aren't just a quick check-in with each other or a connection opportunity. They may need a little bit more. So our way of implementing stress first aid, the largest thing that we do is continuum, check you, check two, coordinate. So in 2020, when we were fortunate enough to learn about stress first aid, and thank you, Schwartz, it was a game changer, we started adapting our language then. So every training that I did, even before we had our formal pitch, I would add the continuum in. I think the continuum is like the gold piece of this whole model. And then we did a formalized pitch. I went to the team, to my clinicians, my director, our executive sponsors, and I said, here's what I just learned. And I think this model is what we do, and that it will give us some structure and will give us the opportunity to be uniform in how we do and say things, so that, you know, we're not just flying by the seat of our pants. So, you know, what I was telling people is, if I'm in Columbus, Ohio, if I go to Cleveland and I have strep throat, I get the same treatment, approximately the same treatment as I would in Columbus. So we're a huge organization. People should get the same type of support with some creativity, regardless of who they're talking to on my team. So we decided to move forward as a staff support team in doing and using the model. And then, like I said, we added it into trainings that we were already doing. We got permission to come to the management committee meeting, which is a required meeting for all of the managers and supervisors, from the C-suite to you know, a CLIN lead to a supervisor. And we were able to pitch the continuum and the check you, check two. It was very exciting and nerve-wracking. We were, you know, worked on it for 6 months before we did it. One of the things that we have are 5 20-minute recordings on our intranet. So people who are not able to come to training, or who have been to training and need a refresher, can go to those recordings and watch them anytime they want. Our approach to stress first aid is, I don't know, like a vaccine. We want anybody and everyone to learn about it. So for our actual implementation, we did use, I don't remember what organization developed it, but someone developed a toolkit, manager toolkit, back in 2020, 2021. We got permission to brand it, use our little logos on it. We have a toolkit, and then we use the continuum and check and coordinate everywhere. And we too have a badge buddy. And We do give them out when you have training, but truth is we'll give them out to anybody, anytime.
Christy, I think we are going to have to wrap up. Unfortunately, I am so sorry. We
That's
ended up
okay.
being a little short on time. All of you had such rich information to share, and I'm going to go out on a limb and say that I think any of our panelists would be more than happy to respond to any questions that you have. If you wanted to reach out to them by email for a little more information on the approach to implementation. I really appreciated how each of you demonstrated some variation in how you approach this work, and Christy really showing how you can have a really mature peer support program and still weave the components of stress first aid into that. So thank you all. That was a really fantastic presentation. We appreciate your time today. And thank you to our audience for attending. We would also like to thank our national business members for their year-round support of the Schwartz Center. This conference would not be possible without them. And we hope that everyone enjoyed this session. We look forward to seeing you at all our sessions, at our next session entitled Fireside Chat, The Power of Storytelling, which will begin in 15 minutes. So please visit Attendee Hub for the link to join. And thank you again to our panelists and to everybody who joined this session today.